Hi guys, I am Dr. Gauravani. Today I have with me Dr. Amit Nabar, who is heading the emergency department at Raheja, Fortis Hospital. Sir, what do you mean by an emergency?
Emergency is an unplanned event. Emergency is any clinical condition which any prudent bystander will realize that needs urgent medical or surgical assessment. In an emergency, a time is critical. It basically means evaluation, managing and treating in an appropriate time frame any critical or acute care illness.
Okay. In case of emergency, why should I visit an emergency department rather than the OPD or a doctor's clinic?
A very good question. See, emergency department as a specialty was thought way back in 1911, and it took another 80 years for the emergency department to be established. That is in 1994, the first emergency department as a specialty was established in USA. In 1999, the emergency department, the Society for Emergency Department was formed, and in 2009, the Medical Council of India recognized emergency as a specialty. Now, how it is different from a regular OPD or a clinic is that it is manned 24/7 by trained emergency care physicians or acute care physicians. The care is standardized. It is based upon the best clinical practices and is the same kind of a clinical care that you would get 24/7, maybe any day, date or time, and it's not depend upon the personnel who is giving that care. So it's a uniform care, a protocolized care based upon a clinical practice manned by a trained physicians 24/7. So that makes it different from a standard or a standalone clinic.
Sir, how soon I will be attended in the emergency department?
Emergency department, in most of the times, if the emergency is less busy, you would be attended immediately. But honestly, the treatment in an emergency department is based upon the protocol of triaging, that is prioritizing the patient depending upon the criticality of the patient. So if it's any person who has, based upon his vital parameters, needs urgent attention, when you enter into an emergency department, he is the one who is going to be attended first. So, and accordingly, every emergency department has a triaging protocol. So you would be taken to an emergency department, you would be triaged or categorized into category 1, 2, 3 based upon your criticality. If it's a priority 1 patient, then he would be immediately shifted to an area or a resus area, and the emergent care would be provided to him without any delay. Okay. If any person can wait for a few minutes, in the event of another emergency which is there, he would be attended as soon as the emergency is taken care.
Sir, I have heard about golden hour. Can you elaborate what is a golden hour in an emergency?
Golden hour. Any clinical condition needs to be addressed as early as possible and has a long impact on the final outcome of the condition. The care that is provided within 1 hour of the patient reaching the door of the emergency department is known as the golden hour. It can be any condition. It can be a person who is having any severe infection, or a person who is having an ongoing heart attack, or it can be a person who is developing a stroke, or it can be a person who is developing having a severe abdominal pain, or is in trauma, or is bleeding from any side. The care that is provided to the person within 1 hour, within the first hour of contact with the hospital, is known as a golden hour, and it can help to save lives in a big way. If it's an infection, it makes a huge difference when the antibiotic is delivered within 1 hour of his admission to the hospital. If it's a stroke, it's very important to diagnose the reason of the stroke and try to establish the blood flow either by drugs or by intervention, mechanical intervention, which can help to prevent the further progression of the stroke. If it's a heart attack, if he is diagnosed rightly, he can be we can undergo a revascularization procedure either in the form of a drug or mechanical in the form of an angioplasty, or percutaneous angioplasty, which can be done immediately and help to save the myocardium from instant damage. If it's a trauma, then the airway and the bleeding that can be controlled as early as possible, which can help to prevent the further harm to these patients.
Sir, as a frontline warrior, what challenges you faced during this COVID pandemic?
Yeah, the COVID pandemic really brought the emergency department into a focus, where the emergency physicians were the front line in diagnosing these patients and putting their own lives at risk, working 24/7 to provide essential care to these patients. So a lot of focus has come on the emergency department, and it was really challenging at that point of time to cater to the demand which was there during the pandemic. But I'm very happy that the emergency physicians across the city and the country rose to the occasion and helped to provide an essential care in a timely manner to the needy and help to save many lives.
Thank you so much, sir, for this wonderful, delightful session and your thought sharing.